So there are things that we can do to prevent having a subsequent stroke.
There are things that we can do to reduce our risk of having subsequent strokes. Treating your blood pressure, making sure that's well controlled.
Why does the blood pressure cause stroke? Is it because, tell me.
Atherosclerotic disease, so plaque buildup inside the blood vessels, hardening of the blood vessels that create this plaque formation, and the small blood vessels don't like that, and they'll fill up with plaque and eventually occlude completely.
And it's the blood pressure when it's high that makes those plaques break loose and cause problems with us?
Exactly, and sometimes high blood pressure will cause little tiny blood vessels to rupture and bleed inside the brain. So we see bleeding type strokes or hemorrhagic strokes related to high blood pressure.
We so commonly see people that say, well, my blood pressure is a little high, but I don't like medicines for it. Very important that we keep it. So you mentioned blood pressure, what else?
High cholesterol.
High cholesterol, so it's important if somebody's had a TIA that you get their cholesterol, and if it's elevated?
Absolutely.
What do you do?
Usually we give medications to help with that. What are called statin medications are commonly used. Probably more important than medications that we didn't mention yet is diet and exercise, right? So the things that we do in our life.
Does that really help? We talk about diet and exercise, lifestyle changes. Your feeling, does that really help?
Absolutely. I do believe it helps. In fact, there are some studies that suggest a 20 to 30% reduction in stroke risk with moderate exercise after you've had a stroke, independent of other risk factors.
I think that's such an important statement. There's a 20 to 30% decreased chance if we diet and exercise. By diet, are there certain kind of diets? We talk about Mediterranean diets, DASH diets, low salt diet, but they're mainly all fruits and vegetables, decreasing especially the red meats. And they're all vegetarian diets. Are they better than just a good diet?
I don't know that they're necessarily better than a good diet. I usually advocate a Mediterranean style diet, but you know, I think you can get just as much protein and nutrition in a vegetarian style diet as you could in a Mediterranean style diet, for instance.
You know, I think people need to know that they can Google Mediterranean diet and they can get really great information on that. And if they have difficulty, see a nutritionist, a dietitian on that sort of thing. Now, what about exercise? What will that do?
Well, exercise, you know, helps with your cholesterol. It drives up that good cholesterol, that HDL. It helps with blood pressure. It helps with your diabetes if you have diabetes. And it'll help you lose weight. And we know that weight loss is important risk reduction for stroke. And there's really good evidence to suggest that exercise helps our cognition, current and later in life.